It's Medicare Monday on the Medical Monday. Folks, if you maybe have heard something in line at the grocery store or at the next table at the cafe, somebody at church told you one thing, you thought it was another, then I have got the solution for you. John Dunn will not lead you astray. John, if you don't know the answer, you have just nearly limitless resources of people who study, practice, prepare for these kinds of questions. We will get the right answer.
We have the people.
But if you do have a question, I guarantee you're not the only one. You can also visit the website, HTANC.com. That stands for Health Team Advantage, North Carolina.com. And John, that brings me to my first woo-woo. This is not a national entity with folks that live on the other side of the country that have no appreciation or understanding for the way you go about living right here in North Carolina.
That's right. We were born and bred right here in the Triad, based out of Greensboro. We are jointly owned by Cone Health and Novant Health. All of our people are here local, our healthcare concierge. They're right here in the Triad, and they talk and speak just like me and you, Jeffrey.
There is something, you use the vernacular, when you talk about getting around town, what's easiest. Your healthcare concierge, they live in the same neighborhood you live. They understand what you're faced with in trying to dealing and navigate the whole realm of medical care. And every situation is unique. And also, Health Team Advantage, owned by Cone Health and Novant Health, somebody goes, well, I always go to Atrium Health, so that won't do me any good. But
that's right. Just because we're owned by those two doesn't mean that is all that's in our network. So we also have Wake Forest Baptist, which is Atrium Health in network. We have UNC Health in network. And then a lot of the independent doctors that are not associated with any of those systems are in network.
Yeah.
So extensive network. We'll be glad to look through your list of doctors and facilities to make sure they're in network with us and go from there.
And that can make a huge difference with your plan as to what's covered or what your copay might be, right? So
that's exactly right.
You need to know.
Yes.
All right, so call if you got a question, and then we can look up. There are files available. There's a magic book, as it were, right?
And now it's just at your fingertips, right at the computer screen.
Just type in a few letters, and wherever your practice might be, whoever your physician may be, whatever your health circumstance is, there is a plan that is in place and works for you. Because, John, so often we think, well, I didn't want the red plan, and that's all you got, so I'm going to have to go in another direction. Now, we've got red, blue, and orange, and green, and purple. There are all kinds of possibilities.
We do. We have a plan that fits most everybody and their particular needs. We have HMOs, we have PPOs, we have chronic special needs plans, so give us a call. I'm sure we've got the plan that's going to fit you.
Well, let's talk about HMO versus PPO. Okay. What's the difference?
All right. So a HMO, a health maintenance organization, those plans do not have any out-of-network benefits other than for emergencies.
Okay.
So if you have a provider that by chance is not in the network on an HMO, you would be responsible for the full cost of whatever services you are having at that provider's office.
All right.
So that's the big difference between an HMO and a PPO. A PPO will give you out-of-network benefits. You may have some higher copays at those providers, but you do have out-of-network benefits.
There may be a doctor that you've known or particularly liked, or even a specialist that's out of network. So that's why the HMO PPO is so important, that you're aware of what kind of plan you're a part of.
That's exactly right.
So there, yeah, and because when somebody says, I want you to go see so-and-so, the easiest way to find out, is that person in my network? Are they out of my network?
Because your list of providers that you may call and give us today, like you just said, there may be a specialist recommended to you in June.
Sure.
And is that provider in network? Give us a call. We will let you know.
And then you have part of that also as well. Maybe I've just moved to the area. Now
we're in 33.
In 33 counties. So you may have moved from another state. You may have moved from one end of the state, and Health Team Advantage was not an option for you, but now it is.
That's exactly right. You don't know what doctors in our area you may need to go to, whether it's a primary care or a specialist. Give our healthcare concierge a call. They will find you a doctor close to your home that's highly rated.
So often we hear these stories, I'm moving here or there to be closer to my family, to
Right.
help look after my grandchildren. Sometimes it's not necessarily a health concern. You're going because you're going to play superhero, and we want you to get out there and enjoy it. But you don't know what doctors are in the area and where to go and how to get the process started. That's why having a healthcare concierge that's familiar with your story and your circumstance,
Right.
you don't have to start over. You get that same person.
That's right. You have your own assigned healthcare concierge, your personal concierge. When you enroll with HealthTeam Advantage, you get their magnetic business card with their picture on it and their contact number, and that's your person.
And you try that with, as we say, one of the big box providers. You
Good
can
luck.
spend another 2 hours tracking down who you spoke with the first time, if you ever find them at all.
Right. You may not ever find them again.
And all of a sudden, you're starting over from the get-go. And it just makes you unhappy and want to give up. And we don't want you to worry needlessly. We want you to get out there and enjoy life.
That's right.
And know that your coverage is in place when you need it.
We have a lot of people this time of the year that maybe have only been on original Medicare,
Sure.
or maybe a Medicare supplement with original Medicare. We welcome those questions as well because, they have friends, they have family talking about these zero premium plans. And
Yeah.
I'm paying a premium. Why?
All right, well, let's talk about that. First of all, original Medicare. So
Yes.
actually, a lot of people think that Medicare is kind of a sole little entity. They've taken money out of my check all my life. Medicare, I'm going to get it when I get to be the right age. But there are
Yes.
4 divisions. There are 4 branches of Medicare.
That's exactly right. So that is an assumption by a lot of people. When I turn 65, I'm going to go on Medicare, and I am going to no longer have any cost for my health care.
Okay, and is that completely accurate?
Completely false.
Oh, okay.
Completely.
All right.
So you may have original Medicare, which consists of Part A, which if you have worked 10 years or 40 quarters over your lifetime, you have no additional premium for Part A. You can qualify for that under your spouse's work time as well if
Okay.
you have not worked 10 years. And that only goes to cover services in the hospital.
Okay.
You also have a huge deductible with that if you're admitted to the hospital. And then you have a 20% co-insurance. So after your deductible, whatever that bill is, if it's another $100,000, you're responsible for 20% of that. And there is no stop loss. There is no cap on your 20%. That keeps going regardless of how high that hospital bill.
And and there are some folks who, again, they'll live a great many years and never see the inside door of a hospital.
That's right.
But that can turn in an instant. That's not to play Debbie Downer and worry you or trouble you, but you got to be prepared.
That's all it is being prepared if something catastrophic happens.
And it can, John, that can turn in 24 hours.
Absolutely. I've seen it, Jeffrey.
So, all right. So, again, you talk about we got the hospitalization, great. And none of us grow up thinking, well, I'm going to use my hospitalization. We hope we don't.
We hope we don't. That's right.
But for a lot of folks, it just comes up and it appears and you want to have it. But there is so much more to your health care plan beyond just the hospitalization.
That's exactly right. So the other part of original Medicare is Part B, and that gives you outpatient services, meaning your doctor's visits, any outpatient testing,
My yearly checkup.
your yearly checkup.
I got a cough and need an x-ray.
Right.
The dog jumped up on me and now I need a stitch.
That's right. So that's Part B, and that does come with a premium for everyone.
Okay.
Other than if you also qualify for Medicaid. Those people will not have a Part B premium. But for most everybody else out there, you will have a premium for Part B. For 2025, it is going to be $185 a month. So yeah, and if you don't take out that Part B coverage, you're going to be penalized whenever you do decide to take that.
And how long does that penalty run?
The rest of your life.
So it's not a one and done, like you got a $25 late fee, like a library book.
That's right.
Now, this will come back and revisit you every year.
Every year. Every year that penalty is there if you don't take it out when you're first eligible. So I encourage people, go ahead and sign up for Part B. The only out you have, like I said, on that premium is if you qualify for Medicaid. You don't have to take it out when you turn 65 if you're going to stay on your group health plan or your spouse's group health plan. So you wouldn't need to take B until you're going to come off of that group coverage.
And there have to be so many employees, right, as a part
20
of
or
that
more
coverage?
employees.
Okay.
If it's under that number, you do need to go ahead and elect B because that will generate the penalty as well.
Because there could be, I just work at a small office and there's 10 of us.
Mm-hmm.
And so that will not qualify you.
Will not.
You could still be in the target for that ongoing penalty.
So now that's original Medicare. Outside of original Medicare, we now have Part D, as in dog. That is your
Drugs!
Drug coverage, your prescription drugs. Once again, if you do not purchase a Part D drug plan when you're first eligible, that will also create a penalty.
Will it really?
When you decide to get a drug plan, and that penalty also sticks around the rest of your life.
So even if I say when I turn 65, I'm going to get Medicare, and I go, I have no prescriptions. I'm the pillar of excellent health.
Yes.
I don't need any drug coverage. I take my Flintstones chewable every day, and I'm good to go.
Yep.
And then
have that
10 years down the road.
Have that conversation quite
Wow.
often. For people who are just aging in, and then also for people who did not take out that drug coverage 10 or 15 years ago, and now they need it. And I have to talk to them, okay, that's great, we're getting this set up, but you're going to have this penalty.
Okay.
And it's the rest of your life.
So go ahead and get while the getting is good.
That's right. Now we come to the fun part. We're going to back up one letter. We're going to go to Medicare Part C or your Medicare Advantage plans. Now these are zero premium plans. Most of them here in the triad are zero premium. They include your drug coverage. So you do not need to purchase an additional drug plan because your drug coverage will be covered under those plans. And then they also pick up a lot of the extra benefits that Medicare does not cover.
Like?
Routine dental, routine vision, hearing benefits.
So just make life simple. So you put A, B, C, and D, roll them all up together, put a bow on it, put it under the tree, and it is your Medicare Advantage plan.
It's your Medicare Advantage plan with a zero premium.
I see that it almost seems like it's too good to be true.
I get that
John.
question too, Jeffrey. A lot is, John, that sounds too good to be true. What do you mean no premium? How can you do that?
Well, I think part of it for HealthTeam Advantage, you want people to enjoy life. You're not headed to the group from church or wherever it may be on the trip out of town because you got to sit and get this figured out at home. We want you to be involved and enjoy and get on with life. Then also at HealthTeam Advantage, there's a chronic special needs plan. Talk us through.
Yeah, so we talked earlier in the show about HMO, PPOs, and I briefly mentioned the chronic special needs plan. We have one of those, and it's specifically for people who have diabetes, either type 1 or type 2, or congestive heart failure. So either of those conditions will qualify you for the chronic special needs plans. What that gives you is your drugs that are used to treat that condition, zero copay.
Wow. Okay.
Your specialist that you go to that sees you for those conditions, zero copay.
Cardiologist, endocrinologist, podiatrist.
That's right. All of those are zero copay. So you'll have some lower cost shares, copays where you need it most for treating those conditions. And our service goes a step beyond. You actually get a care manager with HealthTeam Advantage to help monitor that condition so you're living your best life possible.
Sure.
What we aim for is fewer or no hospital admissions. We aim to keep you out of the emergency room as well. So we do a lot of extra things with people with those conditions to give you a healthier life while navigating through those chronic conditions.
And with this chronic special needs plan, is that available in all 33 counties?
It is not. It is available in 7 of our 33 counties.
All right.
Hopefully one day we will make it to where it'll be everywhere. But a lot happens behind the scenes and a lot of infrastructure built to help people navigate those conditions. So I look for that to be more available in other areas years to come. But for 2025, 7 counties, Would you like me to give those to you?
I would love for you to, John.
Guilford, Alamance, Rockingham, Randolph, Forsyth, Davie, and Davidson.
And then also some of the things which you hope that are included, but let's go ahead and reiterate those. Inpatient hospital coverage and skilled nursing facility.
Yes,
if you have to
included.
visit, that's all part of that. Again, one of those questions, somebody goes, all right, and we hear about immigration so much, and we don't want to dwell on that, but what if I'm here, I'm on my way to citizenship, and sometimes it can impact the accessibility for health coverage plans?
Right. So the easiest thing to do is if you have qualified, regardless of your status, for Medicare, you will qualify for Part C. Absolutely.
All right.
Now we'll get into your other conditions you were talking about.
Yeah, there are a couple here. If you have diagnoses that come up for some folks, and that immediately qualifies you.
That's right. Lou Gehrig's or ALS disease automatically qualifies you to be eligible for Medicare.
And?
End-stage renal disease.
Okay, and the easiest way to know if someone's been diagnosed with end-stage renal disease is in all likelihood they're going to dialysis.
That's right. That's a definite giveaway that you have end-stage renal disease, which will qualify you for Medicare automatically.
And then there's another one, if you've been on disability, but there is a guideline in terms of how long you've been on disability.
That's right. So if you're on Social Security disability, under 65 years old, and have been on that for 24 months, you're eligible for Medicare.
Okay. So we got it. Lou Gehrig's disease, and that is regardless of age, just like end-stage renal disease.
Absolutely.
And of course, there's tend to be the older population, but you could be 50 and find yourself on dialysis.
Yes, you can. I've had a friend who was under 50.
Sure. We were talking about Part D of Medicare with drugs, and in the formulary. And so I knew I had to think on that word. I wanted to get it right. So, John, there are so many drugs listed. It's literally thousands of drugs.
Yes, it's overwhelming, and more drugs are added every year. So you use the word formulary. What is that? Well, that is the list of drugs that a particular insurance company will cover.
Okay.
And those can vary from insurance company to insurance company. And then the tier that drug falls in can vary from company to company.
And there's a myriad of reasons. When you say tier, some drugs will have no copay.
Right.
Some may have, say, this much. Or it could be another tier. It could be this much.
Right.
And the reason we bring this up, for folks who have medications, maybe more than one every month, you want to know. It's not always enough to go, yeah, I've got coverage, so my drugs will be covered. We can tell you with HealthTeam Advantage a specific amount what you're looking at each month, and that will not change for month to month, right?
That's right. We can let you know each month how much that drug will cost, or a combination of all of your drugs, how much you should expect when you go for those refills at the pharmacy, because there's nothing worse than standing at that pharmacy counter and they're ringing you out and you hear a dollar amount way more than what you anticipate.
Yeah, not the place you want to get a surprise. So,
right.
And then the formulary, you could look at it, but I've had to do that with my own mother. And John, it just gets out of control. Did I spell the word right? I can't find it. What's the dosage?
Right.
If you call your healthcare concierge or bring your grocery bag full of medicines to the local benefit center on Samet Drive in High Point, we can go through, look at the medicines. You can spell the name if you're on the phone with us and give us the exact dosage, and we can give you a precise dollar amount. This for budgeting, for folks who are on a restricted income.
Absolutely.
This is essential that you know, what am I looking at every month out of pocket?
It is. You use the word essential, and that is not an underestimation of that word. That it is essential. We have the last part of the Inflation Reduction Act going into play on January the 1st, and that is putting a cap on what people pay out of pocket for prescription drugs.
Sure.
Also, part of that, if people don't know, is your insurance company will now have to finance the cost of your drugs in 12 equal payments, if that's what you want, if that helps you budget. So call us, talk to us about that. What's this payment plan you're talking about, John? Give us a call, because the last thing we want is you going to the pharmacy and having a huge bill in January when you fill your drugs, when that cost could have been spread out over the entire year for you.
Right, and we don't want anybody having to make a decision, am I getting my medicine this month or am I getting food?
Absolutely.
Or am I paying the power bill?
You should not have to make that decision.
Right, and sadly some folks do,
Right.
and we hope this will kind of offset that and find that there are plans and help is available.
Absolutely.
And smart people who will talk you through every step of the way. They're not just going to give you a kind of a math equation and say, just fill in the numbers and you'll get it. No. We will do the work with you.
And explain why.
Yeah. And so when you hang up off the phone, all the questions have been answered.
That's right.
And if you got more, call right back.
Or it didn't make sense to you, ask the question over again.
Sure. There is no time limit. You are not restricted. So, John, folks go, well, I love the conversation. I wish I could sign up. I just don't know if I'm eligible. There are some basic parameters that will lead you to quickly discover whether this is an option for you. And the first one's age, isn't it?
Age is the big one. Yes, when you turn 65, you are eligible.
Okay. Now, if I'm still working, and we touched on this earlier, but I think it bears repeating.
Yes, so if you're still working and you're on group coverage with your employer, and that employer has 20 or more employees on that group plan, you can stay on that group plan. Or if you choose to come off, you can and go on Medicare. If that employer has fewer than 20 employees, you do need to go on Medicare.
Okay.
Let me also touch on COBRA.
Okay.
Because people will come off of their group coverage and go on COBRA, and they think that takes away the need of Medicare. COBRA is not considered credible coverage for Medicare.
All right.
So if you're on COBRA and you're 65, you need to go on Medicare, because when you do go on Medicare, you will have that penalty.
So everybody be aware, COBRA does impact some folks
Yes.
for a myriad of reasons.